So is Obamacare dead on arrival?
Obamacare is a disaster.
What a disaster Obamacare has become.
This is a disaster.
A complete disaster.
Obamacare is a failure. It's always been a failure, and it will not succeed.
It's an abysmal failure.
Obamacare is a failure.
Obamacare is failing.
Obamacare is a failure.
Obamacare is doomed.
Obamacare is doomed to fail.
Clearly, this Obamacare is a failure.
Obamacare has been a failure.
Obamacare is a colossal failure.
Obamacare is a failure.
Good Obamacare is a failure.
Epic collapse.
The whole thing will collapse. Piece by piece, Obamacare continues to fall apart.
And it is now in collapse.
Obamacare cannot work.
Will not succeed and cannot succeed.
That this program is a mess.
This Obamacare is going to go down in flames.
It's been a total fiasco.
This is a calamity.
It's a nightmare. A third world. Sure.
Everybody knows it's an abominable bill.
It's a nightmare.
As this implodes,
Consumer horror story.
Obamacare is not ready for prime time. This isn't ready for prime time.
The law's not ready for prime time.
it is not ready for prime time.
Obamacare is not ready for prime time.
This law is not ready for prime time and will never be.
Obamacare is
Not ready for prime time. This law is not ready
For prime time.
Obamacare is a disaster, a train wreck, a nightmare.
It is a train wreck.
We are not going to get 6 more people to sign on to this train wreck.
It is a train wreck.
It's a train wreck. Train wreck.
This thing is a train wreck.
This healthcare law is a train wreck.
The Affordable Care Act will become a train wreck.
It's a train wreck. It is a train wreck.
The train wreck. Stop the train wreck. Stop this train wreck. This thing is a train wreck. Obamacare is a huge train wreck coming down.
It's a train wreck.
A few of us have even said it would be a train wreck.
Now you have the prospect of a slow motion train wreck.
Slow motion derailment continues its downward spiral.
The death spiral.
The exchanges don't work, and you wind up going into what they call sort of the insurance death spiral.
What did you call it, death spiral?
Insurance death spiral.
Obamacare is going toward a death spiral.
This is that death spiral.
A death spiral. The death spiral, death spiral. What's called an insurance death spiral. You get into what they call that death spiral.
This could be the beginning of the death spiral. It could potentially be the beginning of the death spiral.
The death spiral.
A death spiral?
A death spiral.
That could be the beginning of a death spiral.
That could be the beginning of the death spiral.
That's the death spiral.
And the alleged 1.1 million enrollees announcement is laughable and falls far short of the administration's goal. In fact, back in September, HHS Secretary Kathleen Sebelius was asked to estimate how many people she expects to sign up. Remember this?
What does success look like?
Well, I think success looks like at least 7 million people having signed up by the end of March 2014.
That means in the next 3 months, she needs to miraculously find 6 million people to volunteer for this train wreck. Good luck, Madam Secretary.
7 million by March. No way they're going to hit those metrics. But whatever it is, they need 7 million by March to make the numbers work, and they ain't going to make it work.
6 months ago today, a big part of the Affordable Care Act kicked in as Healthcare.gov and state insurance marketplaces went live. Last night, the first open enrollment period under this law came to an end. 7.1 million Americans have now signed up for private insurance plans through these marketplaces. 7.1. That's on top of the more than 3 million young adults who gained insurance under this law by staying on their family's plan. And that's on top of the millions more who gained access through Medicaid expansion and the Children's Health Insurance Program. And just as importantly, this law is bringing greater security to Americans who already have coverage. Because of the Affordable Care Act, 100 million Americans have gained free preventive care like mammograms and contraceptive care under their existing plans. Because of this law, nearly 8 million seniors have saved almost $10 billion on their medicine because we've closed a gaping hole in Medicare's prescription drug plan. We're closing the donut hole. And because of this law, a whole lot of families won't be driven into bankruptcy by a serious illness, because the Affordable Care Act prevents your insurer from placing dollar limits on the coverage they provide. These are all benefits that have been taking place whole lot of families out there, many who don't realize that they've received these benefits. It's also true that despite this law, millions of Americans remain uncovered, in part because governors in some states, for political reasons, have deliberately refused to expand coverage under this law. Women, the sick, survivors, they deserve fair treatment in our healthcare system. All of which makes the constant politics around this law so troubling. It's working. It's helping people from coast to coast. All of which makes the lengths to which critics have gone to scare people or undermine the law or try to repeal the law without offering any plausible alternatives so hard to understand. I gotta admit, I don't get it. Why are folks working so hard for people not to have health insurance? Why are they so mad about the idea of folks having health insurance? Many of the tall tales that have been told about this law have been debunked. There are still no death panels. Armageddon has not arrived. Instead, this law is helping millions of Americans. And in the coming years, it will help millions more. But the debate over repealing this law is over. The Affordable Care Act is here to stay. And those who've based their entire political agenda on repealing it have to explain to the country why Jeannie should go back to being uninsured. They should explain why Sean and his family should go back to paying thousands and thousands of dollars more. They've got to explain why Marla doesn't deserve to feel like she's got value. They have to explain why we should go back to the days when seniors paid more for their prescriptions, or women had to pay more than men for coverage. Back to the days when Americans with pre-existing conditions were out of luck. They could routinely be denied the economic security of health insurance. Because that's exactly what would happen if we repealed this law. Millions of people who now have health insurance would not have it. Seniors who have gotten discounts on their prescription drugs would have to pay more. Young people who were on their parents' plan would suddenly not have health insurance. You know, in the end, history is not kind to those who would deny Americans their basic economic security. Nobody remembers well those who stand in the way of America's progress, or our people. That's what the Affordable Care Act represents. It is making sure that we are not the only advanced country on earth that doesn't make sure everybody has basic health care.